We are privileged to have with us Mr. Narendra Singh, Program Manager, Adoption for ABDM at the National Health Authority. He will share his valuable insights on his pivotal subject. Please join me in welcoming Mr. Narendra Singh to the stage.
Government, you talk about, you don't expect innovation or something like that, and mostly governments is all about drab infrastructure, bureaucracy, but I'll try to take you through some of the things that we have done, and we have, for digital healthcare, what we are promoting. But before I begin talking about digital healthcare, I think Mr. Mashelkar before me talked about, from financial inclusion and everything happening in this country. So I think, I think at the beginning of this century, when I graduated from my MBA class, so we used to have internet banking, and we used to talk about ATM, but internet banking was limited to accessing your bank, bank statement. You know what is in your bank account, and maybe some of the banks allowed you to open an FD. And we had some ATMs in the country, but if you wanted to withdraw cash, you had to look for the ATM where you had an account, but it was not. So sooner we had an account, you go to any other ATMs and withdraw your money. And after UPI, you could just transfer from the click of the phone money from one place to another. And now when we're talking of digital healthcare, I would be talking about various things, but one thing which we know that when you go to a doctor writes a prescription for you. It is a very good joke that anyone who can understand what doctor writes he has to be very intelligent, beyond intelligent. Only the doctor understands, and the chemist near the doctor, he understands what he has written. So then we start, people started digital, some doctors started writing digital prescriptions, and we have digital reports. But again, all this is limited. Some of the systems, we go to some of the labs, they create a report, and you get an SMS, and you can download the digital records. So what Ayushman Bharat Digital Mission is actually doing is interconnecting all those dots. We are trying to do what UPI and NPCI has done, connecting all those ATMs. So if you have a digital record anywhere in the country, it will be accessible on your phone at any point of time. So that's what we are trying to do. And I think I'll just, So I think sir before me also talked about Ayushman Bharat Digital Mission, and he talked about the, the whole vision of it. The vision is that if there is a digital healthcare system, first of all, we are promoting digital systems. People should start using digital. It's not about using technology only for the purpose of doing tests, doing ECG, doing certain other things, but actually keeping records. And once you have a digital record, it is a digital data. Digital data can be used for multiple things, but for getting the digital data, you have to create the digital data. And for if it is available at various places, not every system has the digital data. India is a big country, and anyone can go to any hospital, any place. So the data is all scattered everywhere. So what ABDM is trying to do is to interconnect them. We are not creating a central warehouse of data, first of all. I think that is something which has to be very clear. What we are trying to do is that data can be accessed by any system. You have money in any of the bank accounts. When you transfer money to other bank account, ICICI works on some system, SBI works on Finacle. Every banking system has their own, bank has their own systems. But they understand that they know there's a bank account number, and there's an amount of money to be transferred. So they have a protocol. So similar kind of protocol we are trying to build in health industry, so that data can be transferred from one system to other. If you go to AIMS and there's a report there, doctor has written some prescription, and then you go to Apollo, the doctor in Apollo wants to have that data. It can be understood by the system that he has. Not only talking about AIMS and Apollo, we are talking about doctors who are in the tier 2, tier 1 cities. If they have a small system, normally doctors don't write a digital system. We are trying to promote that also. I've talked about one of the programs we did 2 years, I think December 22. We started a program in Mumbai itself where, our volunteers went to doctors, and they went to doctors in Dharavi. And they had small clinics, and they told them that there's a digital system available. You can record your patient, whatever problems, you can write a digital prescription and give them a paper also, because the patient wants a paper record. But these doctors, they were not using a computer, they were not using a laptop, they were writing that prescription on a system which was working on their mobile phones. And initially we thought they would start using it just because somebody is coming and they would do it one or two prescriptions in a day because somebody would follow. But no, we came back, my additional CEO, actually he came back here and he saw that the doctor was writing all the prescriptions. That doctor was having a helper outside who was acting as a receptionist, and he said, if I stop using a digital mode now, she will run away. Because she was able to track each and every patient. And one doctor was saying, patients come to me after 6 months and they say, सर आपने वो दवाई दी थी, वो पीले रंग की दवाई थी, मेरे को यही प्रॉब्लम थी, उससे सॉल्व हो गया था, बट वो दवाई क्या थी मुझे नहीं पता. और they have lost the prescription also. But now that he started using the digital prescription, he knows what the problem was and what the medicine he prescribed to that patient. And so the history is available with the doctor, even though the patient is not bringing it to him. So what we are trying to do here is, it's scalable. It is like all systems are interconnected. So it's not one central data warehouse. So we don't need to, we are using the power which is available at all the disjointed systems in the country. So it is federated. As I said, federated is data is lying, it is secure. Before me, the speaker was talking about data, trust, security, privacy, and all those things. So ABDM system is built upon security and privacy. If my data is there in a system, it cannot be accessed by any other system in the country unless I give my consent. And it is available to everyone. So I think what we are talking about interoperability, we are bringing out 3 systems in the country. See, government is doing a lot of projects. We are creating a lot of digital platforms. Government actually has their own HMIS, which is running in government hospitals, which is developed by NIC. We do various programs where we capture the digital data. But this is a program, ABDM is a program, it is not an individual program which is related to capturing data related to BP, intention, or diabetes. I'm not capturing data related to TB. We are not capturing data. We are developing a system where all these systems can talk to each other. So this is what about interoperability. This is the main program that we have is Health Information Exchange, which is Ayushman Bharat Digital Mission, which is the main program. So, yeah. So the data can, if it is there in a, suppose there is a below poverty line income family, she goes to an RCH program, which is Reproductive and Child Healthcare System. The pregnant woman is tested there, she receives her treatment. After that, she goes to another hospital, and she has some other problem, and she goes to a bigger hospital. But the data of that system will be available to the other hospital system also. She can go to a private hospital also if she affords that, because sometimes we believe that some of us believe that private doctor is much better, or it is available in a much better way. So that is the other thing that we are doing is health claims exchange. See, India is a underinsured country. And also people who actually have insurance, they also have problems in getting the claims. And even if you have cashless system, I don't know if you had the misfortune of going to a hospital, but I had it multiple times long time back. But it's like this, once you go to a hospital, they'll take 4 hours to even tell you that your claim is, you can, your insurance company is covering this disease. If you got to be admitted, they'll tell you which room you can sit there. Then they'll give you some number that if your bill comes within this number, they may process. May is a big number there. And after 2-3 days, if the doctor tells you early in the morning, doctor comes for rounds at 8 o'clock in the morning. By 10 o'clock, they finish the round, and the doctor will tell you, boss, you're okay, you can go home. And I can guarantee if you go home before 2 o'clock today, if you have a cashless insurance, if you go before 2 o'clock or 4 o'clock, you must be a very well connected person. No insurance, cashless insurance claim is, you are allowed to go home, the discharge summary, everything is ready by 8 o'clock, by 10 or 11. The doctor has told you, you are perfectly fine. But the whole process of, cashless claim will happen by 4 o'clock most of the times. And imagine the hospital, you are sitting on a bed, the hospital cannot take one more patient because somebody is already sitting there. The hospital technically cannot charge you for that day. So they might have built the cost in your previous 2 days thing. And so there's the whole economics and the time wastage. So what we are trying to do with health claims exchange is that through protocol-driven system, your pre-auth. I think I don't know if you read the news 2 days back. Insurance Regulatory Authority said that the pre-auth should be done within 1 hour. So if it has to be done within 1 hour, it cannot be a dictated by Government of India or a regulatory authority that you do it within 1 hour. So after 1 hour, if they have to do it within 1 hour, what they will do is they will reject it, or they will give you something. They will come up with some. Insurance company will definitely come up with some solution. If it has, so it has to be done electronically. It has to be done through a standard space thing, and we are doing it. We have created this National Health Information Exchange, and this we have worked with all around 30 insurance companies, major TPAs. The whole development has happened. The POC has happened, and soon I think it will be launched. And the next thing what we are doing is unified health interface. We have, during the COVID times, we all talked about digital teleconsultation, all those things happening. But in the end, it was happening through a particular platform. You wanted to do a consultation, you had to go to, you may Practo or you may be 1MG and all those platforms, and they would search a doctor who is available on that platform. Then you would do your consultation and whatever happens. So, but your search for the doctor is limited to what is available on that platform. If you want to buy something today, if you go to Amazon, you go to Flipkart, your thing is you have what is available on that platform. But if you go to Google and you search for something, get whatever is available on the internet. They provide you that information, but they don't allow the transaction to go through Google. So the information is available. What we are doing through UHI is we will get you information which is about the doctors or the services which are available on any of the platform. It can be 1MG, it can be Practo, it can be any other platform, Medibody. And you can actually do the transaction also. So if you want to do a consultation, you can log into Practo, you can search, and all the doctors who are registered on any other platform, they will respond to you. And you can do the consultation. I think teleconsultation is something we don't do very often, but you can book for lab tests. You can book. You can even search for pharmacies which are available. We are trying to do a POC that you can your digital prescription, you can send it to the pharmacies near you, and they will respond back to you whether it's available with them or not. I can tell you with a personal experience. I went to a doctor. He prescribed some medicines, and I came out and I saw a very small shop near his clinic. Then I thought it will not be available here, so I went around and I took a round of around 3 kilometer radius. I didn't find the medicines, and ultimately the medicine was available with the chemist. So it was my sheer laziness that I didn't go that. But other thing is, if I had something, an app with me, I could have just searched for it, and any chemist nearby would have told me that it is available. So that's the kind of thing with the digital power that we will have with UHI in our hands. But so yeah. So how is ABDM is enabling all this? So it's not like one-to-one connectivity. We are sitting as an exchange in between, and everyone will be talking to us. Similar what you have with NPCI, National. So there's an ATM switch. All ATMs are connected there. When we talk about NEFT, there is a financial network there. So everyone, all the transactions from various banks are routed through that gateway and goes to the correct bank, and using your IFSC code and the account number, the money gets transferred. Similar kind of thing will happen with ABDM. So all these systems, they just need to hook up to ABDM framework. So we are developing a framework and exchange. So they need to they need to follow the protocols. They need to exchange data in a certain way. They need to have security systems. We are talking about everyone should follow certain security systems. They need to be certified. They have to be tested on whether they are. It's not that they claim that we are secure. We want them to get certified from agencies which do the security testing. So it spans across anyone: general practitioner, a hospital, a big hospital chain, a small hospital chain, a clinic which a doctor is running out of his small room in his house. Anyone. So everyone is connected. And how do we do it? See, in the end, it's very easy to say, just connect everyone. So what we have done is we have created digital identities for the key players in the system. The key players in the system, first one is the patient or the resident. So everyone has what you call is a Ayushman Bharat health account. It's a health account number, what you have when you go to any place, any system, they have everyone has a customer ID. You go to a bank, they will have a customer ID. You go to a hospital, they have a UHID. You go to any other thing, everyone wants to have one ID tagged to you, a digital ID, so that they know when you come back to them again that you are the same person. But every system having its own identity will not work for us when the data is transferred. So we have given a digital identity to every person, which is Aabha account, which is linked to your Aadhaar, so every person can have only one account. Health professional registry. We are trying to create also a health professionals registry. See, in the country, if today I ask anyone how many doctors are there in the country, I think the number ranges from 10 lakh to 30 lakhs. 10 lakhs people say modern medicine, 30 lakhs when you include homeopathy, Unani, Siddha. There are various branches of medical science, so all those if you include. But still, that number we don't know. Even if you go to the councils, there is a registration there, but if a doctor is not doing a registration again, they don't know. So we are trying to create a health professional registry which will have the identity of all the health professionals in the country. It is not limited to doctors. Currently, it is where the registry has doctors and nurses. We are trying to open it to all other physiotherapists and allied professionals. And the good thing about it, it is not just people have just gone there and registered their identity there. We have a system where it's verified by council or the college. When the doctor says that I graduated from Maulana Azad Medical College in Delhi, and they upload their degree certificate, it is verified by the council. So when you access and you see the HPR ID for a doctor or a nurse, it is a verified number. It's not that anyone can have this thing. Then we also have a health facility registry. During the times of COVID, no one knew whether, which hospital, what are the facilities which are available there, is there an oxygen bed there, or the beds are available. Even the kinds of hospitals or clinics, if I want to do a test, I don't know whether there's a test available. If I go to a new city, God forbid, if something happens to you, and you won't know whether you want to do a test. So the health facility registry is one single stop place where you will have information about all the health facilities. It may be a clinic, it may be a test facility, it can be a doctor's clinic, it can be a big hospital. And when we are collecting data, it is a voluntary information which is given by them. So if Apollo Hospitals in Mumbai tells me that, I have around 500 beds. So we're not asking about how many beds are empty, but how many beds are there, then other information and what are the kind of services they are providing. So this can be used. So it will be, currently we go to Google to search for many things. So it will be better than Google, because Google is something which they are just scanning through various places, or someone has voluntarily put it there, no one has verified it. What we are doing here is we are putting a verified information. And this information is not only available to you through your browser, or if you go to our website, it will be available through various apps. Just before we were talking about PHR apps, personal health record apps, today we have we use Paytm, we use PhonePe to access information about our bank account. So similar kind of things, you'll have PHR apps where we can access information, and those apps will also provide you what are the kind of facilities available near me or the doctor near me. And I said health information consent manager. When I say my information can be accessed by anyone, so it can be accessed by anyone, and the way it will be done is, if a doctor wants my information, he says, I want your medical history for last 6 months, wherever it is available in the country. So this, but it cannot be that, his system will be talking to 10 lakh systems in the country. So we are maintaining a registry which maintains that Narendra Singh went to 5 different hospitals. He went to, January 23, he went to this hospital, February 23, he went to this clinic, and May of 23, he got a test done in HLS labs somewhere, and so all these records are available. We are keeping this directory that I went to this facility and I took there is some record existing about me somewhere. And then when this the doctor is seeking, so message comes to me on my phone that the doctor, ex-doctor is seeking your information. Do you want to give it to him? These are the 3 records which are available. So I think, when I say, okay, I went to this clinic, but it was nothing. I just went to the doctor. He said it's a viral infection. I don't need to share this information. So I don't share this information. Only 2 records are sent to the doctor. So that's where we say consent manager and information exchange. And Aabha app, I've written here Aabha app, but it is like Aabha is the BHIM for us. When you did UPI transactions, when you started, there was an app which was developed by Government of India, which is called BHIM. So you could do a UPI transaction using that app. But now currently there is a PhonePe, there is a Paytm, there is a Google Pay. You can also do through WhatsApp. So similar kinds of apps are also available right now. There are around, I think, 9 apps are already in the market which do the same kind of things. You can do your health information exchange even through Paytm. So if you, because in Paytm it is, it's a big super app. It's hidden somewhere because they focus only on the financial transactions. But if you go to the search and put health somewhere, you will say a Paytm health, and if you click, you will get Aabha. So I think if you have a Paytm, at least create your Aabha account if you have already not done. And the other PHR apps will also help you. They also provide this information. If all my blood test reports are available, they are doing some analytics, and they can show you trends of what has happened to you, for you in last 1 year, 6 months. All these things are available through these apps. And one big thing is, it cannot happen if the digital systems are not there in the country. So every digital system has to hook on to this. So we have currently around 200 systems are already hooked on to us. The number seems less, but one thing good about is that we are not talking about one system happening, having the data of all the people in the country. If you look at US has mainly 2 systems, health systems. I think Epic and Cerner, people from US may corroborate that. So these are the 2 systems which are running across major hospitals. They capture, I think, 80% of the hospital system where the digital records are there. But there is no interoperability. If you can't transfer digital data from one system to the other. But in India, we have innovations. We have people who have created small clinical systems which can be used by doctors, and the cost of that system is only 300-400 rupees per month. Currently, these are given free of cost. It's not running into lakhs of rupees. The doctors are using these systems on their mobile phones. They're not even investing in laptops or desktops. So whatever they had, so all these systems are connected on the ABDM platform. So that is one good thing. So our platform is allowing everyone to connect. So we are democratizing the technology there. Yeah. So I think one thing which all of us like to see, how much is, have you achieved all this? Have you achieved anything? So we have around 62, we use millions, but I think in India, we are talking crores. So we have around 62 crore Aabha accounts created. We have around 2.75 lakh health facilities registered. So these are registered facilities. When we say, when you go and search for them, you know that this facility will exist there. The services which are provided are verified by someone. We have health professionals around more than 3.6. These are doctors and nurses. We are opening up to other things also. And we talk about 38 crore health records are already linked. So these are the records which are created. These are digital records which are created in the system. And these are, out of those 62 crore people, some of those have already health records linked and they can access it on their mobiles. These records can be accessed by any ABDM enabled system. I would have shown you a video, but I think the time is not there. But it is not something which I am talking about. We had, I went to Guwahati in the beginning of the month, where we created a health record in a facility in Arunachal Pradesh, and the system of AIMS was able to fetch those records. And believe me, if I tell you the whole process is, the doctor will create a request, it will come on your PHR app, then I will approve, and then the doctor will refresh his screen and it will appear. So, the time which I have told you this, the shortened version of 1 minute, the record comes on the doctor's application in a much faster way. It is as the way you transfer money using the QR code, it hardly takes few seconds. It's a similar kind of speed which is happening in transfer of health records. Money transfer is only 2 data points in the account number or the mobile number and the amount of money going there, but here the whole health record is getting transferred. Sometimes the scanned images are also getting transferred, and this whole thing is happening. It doesn't happen in seconds, but within minutes it happens. So if you're sitting in front of the doctor, all the records are coming to the doctor's desk within minutes, and it is coming from anywhere in the country. And as I said, we have around, I think this scan and share thing is we like to talk about a lot, not in this forum, but if you go to AIMS Delhi or any other government hospital in Delhi right now, you would not see a queue. Normally, you would see a queue at the registration desk where people, just to go to a doctor, they need a slip, they need to get a registration done. And so normally there would be a big queue which would be extending from the counter to the gates. But after the scan and share, that thing which you have started, it's a queue management system. People have a smartphone, they have a QR code of the hospital, they just scan the QR code and they say send. They profile the information about that patient goes into the registration system, they get a token. And they can just sit there. Once the token number comes, they go over, they tell the receptionist there that, okay, I have pain in my knee, I'm been coughing for last 2-3 days, I have some other problem. Then they can, the person sitting there just decides, okay, which doctor you can go to. And this whole transaction takes 30 seconds and they go away. Just imagine a person who is standing in a queue. This whole transaction of a normal day would take 2-3 minutes. If you are a 20th person, so your number will come around after 1 hour and you're not well and you're just standing there. So the whole queue system, the queues have gone away. And this is happening, we are doing around 1.5 lakh tokens every day. So it's happening in around 200 facilities today, in government facilities. But this can also be used by private facilities. If you go for a lab test, if you walk into any with the facility for a lab, there will be a queue in front of you. You'll be telling which lab test to be done. But before that, you'll be telling, okay, my name is this, my age is this, and all those things. You're just spending time on some activity which is not value adding. So, yeah.
Thank you so much, sir, for having us here and for being here and telling us the importance of teleconsultancy, that how much important it is to have our digital health records, to have all the patient data digitally that we can access like in just 2 minutes or a click away. And you also tell us that it's not just about to digitalize the healthcare organizations, but also the pharmacy, because it's real world problem and we all know it. So it's really important to have the digital power accessible in pharmacies also. And we also got to know about the insurance claim problems that we all face that are real. And you actually gave us the solution that how we can access to have, non-cashless, paperless our insurance policy so that we can get a claim easily and accessibly. And also we got to know about ABDM impact and implementation, that how it is affecting the nation and how the implications is making our life more digital and impactful. Thank you so much. It was our honor to have you on the stage, sir.